Good afternoon, Mr. Lopez. My name is Dr. Alexis Brown. What brings you in today?
Well, I'm having difficulty breathing, and I also have been having cough, as well as have some muscle pain.
So when has that cough started? Or when have all your symptoms started?
Well, it started about 2 weeks ago
Mm-hmm.
when all of a sudden I started feeling very tired,
Mm-hmm.
and that's when it happened.
Do you have like a dry cough or do you produce mucus?
It has no mucus.
No mucus. Okay. So tell me about your symptoms. Are you feeling any fevers or chills?
Yeah, I've been running slight temperature lately,
Okay.
and I've been feeling tired even though I'm getting adequate sleep.
How about headaches or nausea?
Just a little bit of a headache, but no nausea.
Okay. Have you noticed that anything makes it worse, or are you taking anything for it?
Well, I did try taking some Advil,
Mm-hmm.
but so far it hasn't helped much.
Okay. Are you taking any other medication other than Advil?
No, just the Advil.
Okay. What about any like medical procedures or surgeries? Have you had anything recently?
No, I never had any surgeries.
Okay. Are you up to date with your flu shots and your vaccines?
Yes, I did take the flu vaccine through my work.
Okay. So what about your family history? Does anybody in your family have like asthma, problems with anxiety, coronary artery disease, or even like a pulmonary embolism or anything like that?
No, doctor. Nobody in my family has any of those conditions.
Okay. So you mentioned earlier that you work in a factory, right? Can you please tell me like the conditions of the factory?
Well, doctor, recently there has been many visits by an exterminator to the factory in order to try and eliminate the rat infestation problem.
Oh, okay, rats. So at work, do you bring your own lunch or do you buy it there?
I actually bring my own lunch and put it in the refrigerator at the factory.
Okay, the reason why I asked is because I want to rule out if there's any like complications due to rat infestations on your food or any type of contamination. Okay. So tell me about smoking and drinking. Do you have any history of that?
I do not smoke, but I do drink during social occasions.
Okay. What about your diet? Can you elaborate?
Well, I do eat a lot of fruits and vegetables.
Okay, and do you exercise regularly?
Well, I know I should, but it's just that after work at the factory, I'm just exhausted.
Okay. Okay, well, Mr. Lopez, right now I'm going to go into doing your physical exam so we can check out some of your vital signs.
Okay.
Okay. Okay. Okay, Mr. Lopez, so I'm going to start by taking your heart rate and your respiratory rate.
Okay.
Okay, let me see your arm. Okay, and then just breathe normally. Okay. Well, your heart rate is 115 and your respiratory rate is about 25, which is pretty elevated.
Yeah, I've been feeling like my heart has been racing lately.
Oh, really? How long have you been feeling this heart racing?
Since this morning when I woke up.
Okay, let me take your temperature.
Sure.
I'm going to put this underneath your arm. Okay. Oh my, yes, you're at 101.7, which is very concerning.
Well, I'm not surprised. I'm even feeling worse than I did this morning.
Okay. Okay, well, let me take your blood pressure.
Sure. Right or left arm?
Left arm, please. Okay, this is going to be a little bit tight. Okay. Well, your blood pressure is pretty low. It's 100/65, and that is very concerning. So let me check your ankles for edema or swelling, and then you'll check your nail beds. Okay. You check your nail beds and your lips for cyanosis. Okay. Yeah. Okay, well, it appears that you have a little bit of cyanosis and there's swelling in your ankles, and that tells me that your extremities are not getting enough oxygen. So let me listen to your heart and your lungs. If you would lay back on the table for me. Okay. Just going to listen to your chest. Okay, and sit up. Listen to your lungs. Okay, take a deep breath in and out, and in, and out, in, out, in, and out. Okay, Mr. Lopez, it sounds like I hear an extra heartbeat or extra heart sound, and that's abnormal. And also I hear a little bit of rales or edema in your lungs, so that tells me that there is fluid in your lungs. That's very concerning to me, so I'm going to admit you into the ED.
Sure.
Okay.